Hello, class. Welcome to my mini lecture on wound healing, which is a continuation of what we've been learning about in chapter 2 on inflammation. Okay, wound healing. So wound healing is defined as a dynamic process by which the skin or other body tissues repair itself after trauma. So we're going to cover a number of topics, the types of healing that occurs, normal, delayed, non-healing, the specific sequence of events and the cells that are involved in this process, primary and secondary intention, and a variety of complications that can occur. So there are a number of things that determine how a wound is going to heal. So we're going to review those things at this point. So one of the important aspects is the site of the wound. That is, where is it occurring? So if it's occurring in the skin, it's going to usually heal very quickly. If it's occurring in the brain, there will not be healing at all. The size of the wound is important. So if it's small, we know it's going to heal much faster than if it's large. Mechanical factors. So the wound initially as it's healing is weak. It's not a very strong area of tissue. So the tension on that wound, if it's excessive, it's going to pull the wound apart and keep it from healing properly. Same thing with if it occurs in an area of a lot of movement, let's say in an elbow or on a finger, something that's moving a lot. Again, healing will be delayed. It's going to be more difficult. And of course, if you have problems with foreign particles getting into the wound, that will also delay healing. You can think of if you have a scrape, you've fallen down, you get the sand and dirt in that wound, that has to be cleaned out. And if there's still residual left, then that will interfere with the process. And of course, infection. If you have a sterile wound that you might get during surgery in the OR, then that is going to actually be a much cleaner and more obviously sterile situation than a wound that you get normally just throughout in your life, in your daily life. And those wounds usually always get infected. Circulatory status is very important. So if you have ischemic tissues, here again, you may not get any healing, or healing may be very restricted. Think of gangrene, think about dry gangrene where you have no blood getting into those areas, everything dies off and the tissue either will fall off or will need to be amputated. So getting a blood supply and having a good blood supply is very important. Nutritional and metabolic factors. So malnutrition where you're not getting all the nutrients that you need just to keep your body going and for the repair process, not having those available, having a vitamin C deficiency. This particular vitamin is very important for the healing process. And a disease, let's say like diabetes, which actually does create a problem with microcirculations. So healing is always delayed in these diabetics, especially if you have diabetes that isn't controlled and is longstanding. You can even end up having such poor circulation in the limbs that you end up needing amputations. So that is not uncommon with older diabetics that haven't been careful with their disease. Age again is very important. Children will heal much faster than the elderly. So there are a number of cells involved in the process. We all know about neutrophils already. These are the first cells to arrive at a site of injury or trauma or infection. And their primary goal is to kill pathogens and to clean that injury site. We also learned about macrophages. We know that they are masterminds. They're always involved in the process of inflammation and very much so in the healing process. They actually direct it. And they are involved in secreting various mediators that will stimulate a variety of cells to come to the site and participate in the healing process. So we're going to talk about those specific cells now. So there are 3 of them. We have fibroblasts. These are the cells that produce most of the extracellular matrix that is needed to recreate normal tissue. And they have a variety of secretions that do this, especially collagens. Collagens, there are quite a few, there's quite a variety of them. It depends on the stage of healing as to what's present, but they actually will provide the strength that's needed to hold that newly formed tissue together. Myofibroblasts. So these are interesting cells because they're actually a hybrid cell that resembles muscles and fibroblasts. So like a muscle cell, they are able to contract within the wound. So what that does is they can bring the margins or the edges of the wound closer together. And also they can reduce the size of the overall defect by this contractual process. In addition, they also secrete various matrix substances that are needed to form and mature that matrix. And finally, we have angioblasts. So angioblasts are actually, if you look at the word angio, means vessel, blasts are immature cells. So they are the first cells that are present to create the new blood supply into this developing tissue. And as you know, without a blood supply, you can't have living tissues. So this is very important. Initially, you have an abundance of these vessels that are rapidly bringing everything to the site that's needed. As the tissue matures, you get fewer and fewer of those until the mature tissue has just what it needs to stay viable. So this initial immature tissue is called granulation tissue. It is very rich in extracellular matrix, and it has a lot of these newly forming blood vessels and a lot of the cells that are needed for the healing process. So when you see it, it's a bright red. If you were to kind of probe it, it would bleed easily. And again, this is due to all the blood vessels that have formed and also the presence of inflammation. And actually, it's something that we see almost regularly. If you have a scab and it comes off too quickly, that tissue that's underneath it is granulation tissue. And that explains why it has that reddish appearance and why it does, why you will get renewed bleeding if that gets exposed. So this granulation tissue is very dynamic because it is constantly changing as it goes from that immature state to the mature state and of scar formation. Unfortunately, things don't always go as planned, and the process can be delayed and sometimes never even completed. So in those cases, we'll see a wound where there's a lot of granulation tissue and it just doesn't seem to clear up. And then the surgeon or even the dentist, depending on where the problem is, has to go back into those areas, clean out all that granulation tissue that's formed. There might be something in the wound site, like those particles we talked about that need to come out. There's something that's holding things up. And so cleaning everything out and starting from fresh is often what you need to do to get healing. Just a little chart that shows beginning and end in a sense. Here is the immature granulation tissue. You see a lot of these blood vessels, a lot of cells. You see a little bit of collagen present. And then as you get that mature tissue, you see much more of the collagen present and also fewer, and it would be more mature blood vessels at this point. And just a picture of what granulation tissue looks like. And it probably looks a bit familiar to you. The color of it and it looks a little bumpy and it would bleed very easily. So let's go on to the actual types of healing that we have. There are two types. One is primary intention, and the second one is secondary intention. So we're going to start with the primary form. And here, this is pretty much restricted to that small, very clean-cut injury that you see with surgical incisions. You can also see it, let's say, with a paper cut, or if you get a small cut on your hand from, let's say, broken glass. Just very, very clean cut. So the margins of the wound they're not ragged, they're nice and smooth, and the wound, those margins just come together very easily. They just normally close the wound up. And because of this, and because of the tissues of the wound actually touching together, they just adhere to each other, and you get very little granulation tissue forming, and you get healing that's coming in from the sides of the wound. So the epithelial cells just immediately are able to seal things up, and then blood supply and everything very quickly is reestablished. So fast healing with little or no scarring. And this is just a diagram that shows the process. Here you have the incision. Here you have some white blood cells present. You can see how there's very little gap formation between the two sides of the wound. In this case, you have some granulation tissue forming. Remember, you might not even get any little scab. End result is you do not have a visible scar. Any scarring that occurs as scars will occur below the epithelium. We move on to secondary intention. I'm sorry, I think I missed a slide. It can happen. Let me go back. Okay, secondary intention. So this is what happens with larger and all infected wounds. So this is what normally takes place, because very few of our wounds occur in the OR. So in this case, the margins are open, they're gaping open, or they're so far apart that they would never be able to come together, such as an ulcer would create, or a scrape, where you just fall and that top layer and gets sheared off. The edges of the wounds, there's no way that they can come together. So in this case, the granulation tissue forms and will fill in the defect, and you will get healing from the bottom up. So be sure to remember that primary intention healing is from the sides. Secondary intention is from the bottom up. And of course, this means that healing is going to take longer, and you will end up with more scarring. And a little diagram that shows the various options here for the wound creation. You have the gaping wound that's open. You have a wound with foreign body in it, those sand particles or dirt or whatever. And here you have bacteria that have entered. So this would be an infective issue. So you get this open wound. You see that the granulation tissue is formed. This will fill this area in. And eventually you'll get, hopefully if it's not too big, you'll get this area pretty much covered by the epithelial cells. We'll just come in and cover this, and hopefully you will not get scarring. But if it's the wound is too big, or this process is too long, it's going to take too long, then you will get a lot of scar tissue forming that will be visible. And then this is a healing wound here. Probably it might be a child or whatever, someone may have fallen on their cheek. Here you can see granulation tissue. Here you can see we have sort of the epithelium starting to move in, less and less granulation tissue, and still an immature wound, but pretty much closed up now. So to just review the basic stages of wound healing, initially there's going to be bleeding. So step one is hemostasis, which means that you are controlling and stopping all bleeding. Next step is inflammation. So that's uh, uh, initiated right away, and that's designed obviously to combat infection and eradicate the pathogens that are causing the problem. Third step is proliferation. Here we have the formation of granulation tissue. And finally, at the end, things are maturing. We get reepithelialization. That's the covering over of the wound, either with completely with epithelial cells or with a combination of epithelial cells and scar formations. And depending on what type of wound and the size and the healing process, you may get more scar formation than you would want, obviously. A little video here. I can't show it in this presentation, but you'll find it again in your modules. And it doesn't go into a lot of detail, but it's nice in that it visually shows the process. So view it, it'll help to reinforce what's happening. So complications. So two big categories for complications. We have a category where we have a deficient or not enough scar formation, and then we have a situation where we have excess scar formation. So if we don't have enough or good enough scars being created, the wound does not develop adequate strength, and it won't close properly. It can be pulled apart and the margins will separate. So this is the result of insufficient development of tensile strength. Tensile strength being the strength of something that resists being pulling apart. So this is called dehiscence, a wound opening up. So in contrast to that, we have excess scar formation. Not that uncommon is what we have when we have keloids form. And keloids are situations where we have excess scar tissue, and some people are just really prone to it. I know I've had some, fortunately nothing on my face that would be disfiguring, but they can be just because of what they look like. And then we have it as a real extreme contractures. So these are very large scars, and they're often the result of burns, particularly electrical burns. And here, the scar is so big that it actually pulls the surrounding normal tissue towards it and tightens that tissue up to the point where that can actually impede the movement of that particular part of the body. And so I have some pictures. This is dehiscence. You can see it looks like there's some sutures that were placed here. The sutures probably came out in this part of the probably incision, and you can see the gaping. So this would need to be cleaned up again and resutured, probably with more sutures to hold everything together. And then we go to the keloid scar, and here you can see this is raised, and it's it's discolored, and a little less here, a little more here. So depending on where this is something that a plastic surgery may need to treat, to get rid of. And then finally, as the ultimate extreme, obviously a severe injury here, massive scarring on the face down along the neck to the chest. And you can actually see, if you look closely, that the skin is being pulled in. It's very taut. And there would obviously be some problems with range of motion in this area. And that is it. Okay, class, just study this video. It pretty much is a summarization of what you will find in your book, and be sure that you do know wound healing, what happens during the process, the various stages of wound healing, what can go wrong with wound healing, and what just affects the process and the cells that are involved. And I will see you in class. Have a good day.